All right, we're live. Hey, everybody, it's Dr. Ashley, pediatric emergency mom, and I am very fortunate to be joined today by Dr. Katharine Rose, who is family medicine. And I think just kind of funny story that she and I actually don't know each other at all, just met. We are in the same, so there's a physician moms group, and then there are lots of other branch physician moms group. And so we have a South Louisiana physician moms group. So we kind of social media know each other from that group. And when I was asking for recommendations for discussions on lives, I got requests from adults, Katharine, questions about their own care. And so I had reached out to the South Louisiana physician moms group and said, hey, are there any, I think I said like OBGYNs or family medicine or primary care, like adult primary care, and ENT, I think. And so Katharine was very gracious to volunteer to talk to us. So thank you for joining us.
No problem.
So Katharine, family medicine is near and dear to my heart. My uncle is retired family medicine. He's in his 70s. Really, the only reason he retired is because he has post-polio syndrome. He had polio as a toddler. And that's a whole nother discussion. And so he physically just had a hard time with his practice. So he closed down his brick and mortar practice, but you can't stop him. And he kept his license active. And so he's like back to like old school house visits, right? Still does that. So I grew up in his office, and my mom was his transcriptionist. And so he is how I developed a love for medicine. And so I love family medicine, and I think that you guys are amazing. But I'm just curious, like, what made you choose family medicine?
Well, first, let's talk about what is family medicine. So, when you think of a family medicine doctor, you frequently think of what we call a general practitioner, someone who does everything. Marcus Welby did everything. Did he have a residency? I don't know. But family medicine is a residency. Until about 2000, some people called it family practice. So you might hear people call them FP or family practitioners, but now we've kind of all gotten into the family medicine boat. I think that was really more aligned with the internal medicine people to say, there's a lot of crossover there. In family medicine, we talk about cradle to grave care. During my residency, which I did a 3-year residency in just my specialty, which is family medicine, and we delivered babies, and we did hospice, and we did hospital care, and we did outpatient care. It's a lot. It's a lot. And a lot of family doctors end up being like the country doctor, the only doctor in the county or the only doctor in Wyoming. The typical family doctor does a lot of outpatient. Some of my colleagues are in the hospitals now, but a lot of us, we run clinic. I live in Metairie, which is a suburb of New Orleans, and there's a lot of doctors here. There are 3 medical schools. And so really my practice is adult. I see adolescent to adult. There's plenty of pediatricians here. Having a pediatric practice is its own complicated thing. So I don't need to do that. So I'm very happy to send the little ones to the pediatrician. Now, if we were in, Utah and there was no other small person doctor around, I suppose, I could take a refresher. I do outpatient care, which is so people come to my office and they get their blood pressure and their diabetes and their attention deficit disorder and their depression and their thyroid and all those things treated. And like I said, there's a lot of crossover with internal medicine. We try to take care of our patients from cradle to grave.
And I think, how often, how am I asking this question? My brain is kind of scrambled. So in pediatrics, we often see, like, we're not, or my colleagues will tell me in the outpatient setting, because I'm in the emergency department, that patients often don't come in for annual visits because they're well, right? They just
Right.
They will, and they don't need to see the doctor. Do you find that happens in the like adolescent to adult population as well?
Absolutely.
And then can you speak on how important it is to go once a
once
year?
they graduate from a pediatrician and their mom isn't taking them to the doctor anymore, there's probably about a 20-year gap where people just don't go to the doctor very much at all.
Wow.
Until they're about 40. And they'll use urgent cares. They use the women will use their gynecologist as a primary care doctor. And that's fine because the basic, most important part of care in that age group is sexual. STDs, getting pregnant, taking care of your body. These chronic illnesses like heart and lung, that kind of stuff, often doesn't really manifest until later in adulthood. So there is a big gap where I see the patients once a year. If a guy comes in and he's 25 and he says, "I just need to see the doctor," it's it's because he's got
Is it shocking?
something wrong. He's got something wrong, or it's not getting done.
Yeah.
So
yeah.
There's a big gap. Is it critical that they come to the doctor? Well, I think it's critical that they have access to care, right? So when I do a physical on a healthy 29-year-old, I'm probably not going to find anything amazing. But I want to be there because when they do have strep throat, or they do have the flu, or they do have something that they can't figure out what it is, they should come see me, who knows them and knows that maybe when they were a kid, they were hospitalized with pneumonia 6 times, and that we really need to keep an eye on this person, or they had tubes in their ears 3 times, and that they tend to get ear infections. So some of those things that happen when you're a kid do carry forward and can help direct your care in an appropriate way. Whereas if you go to urgent care, you're going to get a practitioner of, it might be someone you've never seen. It might be someone who doesn't have as much training. It might be someone who is filling in for somebody else. There's a real loss of continuity of care, and that can affect your health in the long run.
Yeah, definitely. And I know I've had friends message like I have this going on, like I really need to see a primary care doctor. Who do you recommend? And then they'll message back like, well, I can't get in for months. And I'm like, well, you're not an established patient. So this is why it's important to keep up that relationship.
And I tell them, just come see me every couple of years. Now, insurance becomes a big factor. So most people have insurance through their employer, and employer-based insurance is usually through a large insurance company, Blue Cross or Cigna. And those companies will pay for a wellness visit once a year. And the purpose of that visit is to maintain a relationship with your doctor, go over what wellness needs you might have. Are you short on some vaccines maybe? You haven't had any since you saw your pediatrician. Has anyone talked to you about depression? Why are you crying so much? To establish that relationship, I say come in every couple of years. You don't have to come in every year. Come in every couple of years. Do you need blood work? Maybe not. Let's talk about your health.
Yeah. No, that's a great point. And I think something for parents, and like something I guess I didn't think about either, is to have those conversations with your teenagers, like as they're getting older. I mean, obviously, like I'm going to stay on top of my kids, right? Like white on rice, to make sure that they're taking care of themselves. But when we're talking to our kids, if they're transitioning to college, they're moving away. In our emergency department, we actually see to the 19th birthday.
Mm-hmm.
And so we'll often get freshmen in college who are from New York or Vermont or wherever. And then they're putting the mom on the phone, right? And the mom's like, I told them to see a regular doctor. And so that's always an interesting conversation to have.
My son is 18. He just went off to college in the fall. He has never been to the doctor without me. And, because I'm a doctor, maybe I should have made that happen. So I'm happy to report he has a new primary care doctor. I set him up with a family medicine doctor that I kind of know. And he's going to, when he comes over the summer, he's going to establish care. So establish care, what's that mean? Get in there, not a new patient. So if you need something, you can get it there.
Yeah, I think that's an awesome a point too, because when your kids are leaving the nest, finding, especially if you're going out of state or wherever for college, but you want to find them a nice dorm or apartment, find them a nice, but also like, let's see what medical care is in the area,
Yeah.
for establishing care, but also like for the just in case scenario,
Well, and not every kid's mom is a doctor, right? And
right?
so, the other kids don't have access to, hey, mom, I got this weird rash on my hand, and is it my pencil, or do I have shingles, or, and because he can get on the phone with me. Other kids don't have that. And so, really, they don't even know, like, when do you go to the doctor, right? So, you're an ER doctor, and you know that sometimes when people go to the doctor, you think, you've been coughing for 3 hours, they could probably wait.
Yeah. Also, you've been coughing for 3 months, and why are you just getting seen today?
In the emergency
Yeah.
room, right?
You
Yeah,
haven't seen anybody? Like,
right, right.
um,
Because they don't know what's the cutoff, right? And
yeah,
it's different in a different time of your life, right?
absolutely. And you touched on vaccines. So that's something that our parents have asked is like, when do I get my and I think a lot of adults don't even know what vaccines they need anymore
Right,
if
right.
they're not going
Well,
to the
it's
doctor
complicated.
regularly.
I'm going to show you a vaccine schedule that is put out by the American Board of Family Physicians. This is this is the adult vaccine schedule.
Okay. Okay.
And this is, if they're late, this is what we have to do. So there are a number of vaccines. Some people aren't from this country and they have a different vaccine series. A lot of kids, if they go to college, they get up to date. They get kind of forced up to date because the college is expected. They get that meningitis and the tetanus updated. But people come see me in the 35 and they haven't had a shot since they were 18. Yeah. So coming to see the doctor in that wellness visit, that's one of the things we talk about, immunizations. What do you need? And even though you're 35, you have a cochlear implant, and maybe you need shots that other kids don't, right? And so having someone that's familiar with you. And kids, of course, in their 20s, they think they're indestructible. They're not going to get the flu. They're not going to get COVID. It's, yeah, whatever. So there's a lot of talking that takes place about, let's talk about risk. What is your risk, and what shots do you need? The other issue is access to vaccines, right? The regular pediatrician carries vaccines in their office. I don't.
Really?
Yeah, I do flu shots, but that's it. And why is that? Well, if I buy a bottle of tetanus and it's got 10 shots in it because I need one, what happens to the 9 shots?
Yeah.
I have to throw them. I end up throwing them away.
Hmm.
And so I just don't stock vaccine. There is a health department in most territories. There's one in my parish. I'm sure there's a couple in your parish. And you can get vaccines there. Let me tell you, it's not easy. It's one day a week from like 1 to 3 p.m. And I went in and I kind of was aggravated. I'm like, does it have to be during school time?
Yeah.
Right? Couldn't it be like 3 to 5? Because
Yeah.
maybe you wouldn't have to take the kid out of school because they need their meningitis jab. So the vaccines are available. A lot of them are expensive. HPV is $300.
Hmm.
So if you're getting it, you have insurance, great, and you're able to get it through your pediatrician, great. But once you leave the safety zone of pediatric vaccinations, suddenly they're not well covered by insurance, and finding that shot is not always straightforward.
Interesting. So, but then I think, and this would be I think a question for you, and then a question for our pediatric colleagues is when you're nearing that like out of parents insurance coverage and away from,
Yeah,
or maybe moving or whatever, um almost like you're like if you have your driver's license to have a vaccine, like, hey, in the next 5 years you're going to need a tetanus booster, and in the
right.
next, just to have a roadmap and thinking ahead of,
Yeah,
I
yeah.
need
Well,
a plan for this.
when I went to medical school, I pulled out my mother's handwritten vaccine card, that said that I had the chicken pox when I was 1 and that I'd had these different shots at different ages. Now we have links, right? So the Louisiana network, it's a vaccine network. And so we can pull, if you had your shots in Louisiana, we can pull and see what you've had and what's due on the bottom of it, prints right out. Now, let's say you're from New York and you're going to Tulane University or LSU. I don't have access to your shot record. So that's something every kid should take with them.
Yeah, it's such a great website, truly. We'll see more than anything, we're looking up tetanus for injuries, and the parents are inevitably like stressed, and I'm pretty sure they had it. I don't know. And then they're kind of freaking out, and I'm like, you know what? It's okay. We'll just look it up on this website.
All right, we'll look it up. And of course, most little kids have had a tetanus shot. I think the last one's at 6, that DTaP.
Mm-hmm.
Okay. And then when they go to college and they're 17 or 18, if they go to college, they get another one. You also get a tetanus shot when you've had an injury. And so normally it's 10 years between shots, but if it's been an injury, we do 5. You still do 5 in the ER?
Yeah. 5.
And then with my adults, I say, when's the last time you had a tetanus shot? And they say, oh, I had one for Hurricane Katrina. I'm like, well, honey, that was 19 years ago.
A long time ago.
I'm pretty sure you're due. But again, we get to paying for it.
Yeah.
Because some insurances don't cover tetanus unless you have an injury.
So this is a funny story. This was, I think it was about 3 years ago, maybe 4. It's less than 5. I know that. But my husband was out of state and I was home with my kids, and I barefoot stepped on a doorstop that's like an old iron fleur-de-lis.
Old rusty doorstop.
Impaled the bottom of my foot, and couldn't remember, because I had my first son in Memphis and then my second son here, and I knew I got the tetanus with one of them, and I couldn't remember which one it was, because if it was my younger son, then I would have been covered.
Mm-hmm.
But I couldn't find any documentation.
Typically, pregnant women get the tetanus vaccine with every pregnancy unless they're less than 12 or 14 months apart. So typically, you would have gotten it with every pregnancy. Now, that didn't start that long ago, because I remember when I had my kids, I did not get a tetanus shot with my pregnancy, and my youngest is 15. So in the last 10 years, we started getting tetanus. And it's really not about the tetanus shot. Why do we give tetanus shots to pregnant women? Pertussis, right? So
right.
This tetanus shot has 3 things in it: tetanus, diphtheria, and pertussis. Why diphtheria? Do you know anybody with diphtheria? Please tell me you've never seen anybody with diphtheria. I've never seen a patient with diphtheria. I can tell you there are cemeteries full of diphtheria patients in New Orleans, but I've never seen it. The reason we have that is it's an adjuvant. So putting the tetanus and diphtheria together makes the tetanus shot work better. Okay. And then pertussis, we don't want babies to get pertussis. Babies do not develop a good response to the pertussis vaccine until they're 6 months old. So now we want to get a cocoon of protection around that baby. So mom needs to get it. Dad needs to get it. The kids, they're usually vaccinated because they're on that kid series. Grandma and grandpa need to get it. And so frequently, grandma and grandpa come to see me, family medicine doctor, and they say, I need a tetanus shot. My daughter's having a baby. I want to make sure we have a cocoon of protection around this little baby, because pertussis in babies is awful. And they go to get it, and the pharmacy says, what's the diagnosis? And they give them a lot of pushback. So I say, next time you got a hangnail, come see me. We'll put a diagnosis code on there, and we'll get you that pertussis shot. There's a way around it. Yeah.
Well, when that happened to me, and I do want to circle back to diphtheria actually, but when that happened to me, I went to urgent care, and I said, like, my foot's fine. I have topical antibiotics. I have oral antibiotics if I need. I just need a tetanus shot.
Yeah.
Like that's all I need. And she laughed. The nurse practitioner laughed at me because she's like, "You're the easiest patient I've seen today."
Yeah.
Like, that's all I need.
Well, when doctors go to the doctor, they frequently drive their own care, which is good.
Yeah. I just want to make it easier for you, right? Like, I don't need all of these other things.
Yeah.
So you,
So the
you
lesson
brought
here
up,
is get a tetanus shot. If you have a bobo, get a tetanus shot. If you can't remember, get a tetanus shot. Well, it hurts to
yeah,
get it twice.
no,
You can have a tetanus shot once a month, and it'll be fine.
right. That's
You
why
go
I
that
was
way.
like, if I already had it, or if I had it within the 5 years,
Get
oh
it
well,
again.
it doesn't matter.
It won't hurt.
And the good news is now I remember when my last tetanus shot is, kind of
Right.
within a year, right? I said 3 or
Yeah,
4
people tell me
years.
that
So,
all the time. I broke my ankle and I got a tetanus shot, or I stepped on the doorknob and I got a tetanus shot. People remember
yeah,
that incident, and I write it in their chart. Went to the urgent care, stepped on something. Yeah,
yeah.
and
So
and,
you
and frequently that's uploaded to their links, their state database, and yeah, it's there. But maybe they were skiing and they got a tetanus shot in Utah.
right, right.
Yeah,
Um, so you brought up diphtheria, and so like what we know of diphtheria is what we studied, right?
right.
And I remember the pictures, right, of the back of the throat of this like plastic. It looked plastic, right?
Yeah, yeah.
It's
There's a
like
gray. There's a word for it, like the entire lining of your throat sloughs off. Yeah.
yeah. And so something that's come up on a lot of physician message boards and social media groups lately have been, physicians who've never seen
Never seen it.
HIB and
Yeah.
never seen diphtheria and never seen reaching out to some of the older physicians and like,
I
hey,
would say most young doctors have not seen chickenpox.
yeah,
Yeah.
we
Yeah.
I've seen a few cases, but the I with all of the misinformation about vaccines
Mhm.
and the vaccine hesitancy, I never thought that we would be in a place where I'm having to ask my attendings, like my attendings in fellowship,
Mhm.
um, did train at a time when they saw babies with Haemophilus type B, meningitis, deafness,
Yeah.
right? And so
Yeah.
now having to reach back out to them and say, hey, can you tell me about this again? Like, what did you see?
Yeah.
And and so it's just a not
Well, and for instance, you said your grandfather had polio. My cousin had polio, and she has a short leg. If you but vaccines are a victim of their own success. Most people have never seen a polio victim. They think it happens in Timbuktu only. It won't happen to us. Polio is horrible. Polio attacks children, and it kills them, or they can't breathe, or they're permanently damaged. If a polio attacks your limb, it never grows. You know, but most people haven't seen polio. You and I happen to have a relative with polio. That's really rare.
yeah. And just the stories, right, from my mom, my grandmother, of him being in the polio ward, right? These kids were taken away from their families and they were put in polio wards, and they only
Yeah.
had short visiting times,
Mhm.
like once or twice a week,
Mhm.
for months.
Yeah.
And
I think my sister said that Nancy, who was her similar age, was in the hospital for a year. A year.
yeah.
Yeah.
So this is why I do these videos and have these conversations, is and try to do them as objectively as possible, is to create a safe space for patients, or parents, patients. A lot of them maybe are hearing a lot of vaccine misinformation, but
Sure.
they have their doubts about that,
But
and
it's
they'll
really hard to say, I need a shot for polio. I've never seen polio. Nobody I know has polio. Why do I
right,
get a shot for it? It's like diphtheria. There's
right,
no diphtheria in the United States. Why am I getting a shot for it? So when you think about it that way, it kind of makes sense.
yeah,
You don't vaccine for smallpox anymore, right?
yeah.
Because it's gone. But it's not really gone.
Right. And I've found, and especially when it came to the COVID vaccine, if um, family, your family unit, all of your friends are very anti-COVID vaccine, but you have your doubts, you have your hesitations, you don't know who to turn to.
Yeah.
And so then I had quite a few people private messaging and asking questions and saying like, I don't, if you could do a live on this, but please, I want to remain anonymous,
Yeah.
which is, heartbreaking, but I'm glad there are people like us who can provide that accurate information for them.
Well, and COVID was tough because it was a moving target. Like, okay, what's next? Well, how long do we need it? We still don't know that. How long, are we going to be doing this? We still don't know.
Yeah.
We have,
Heather, oh, sorry, go ahead. I wanted to read. So, my very good friend Fairly, is watching and left a couple of comments, and I wanted to read these comments. So the first says, I think I saw my pediatrician until I was 20 and they had to fire me as a patient.
Yeah.
It happens, right?
Mm-hmm.
And then she said what you said, like she hasn't had a quote GP, a general practitioner, in years. She had her NP at her OBGYN that was her everything and coordinated everything for her.
Okay. As long as that's somebody.
But she said but that provider just retired. And so she feels at a loss for general care. So for patients like her who are new to like, I need a primary care physician, do you have advice for starting that process?
Yeah. Well, ask your friends. Who's your doctor? Do you like them? How easy it is to get a message to them? How quickly can you get in to see them? Do they have a backup? I'm in private practice. I don't have a backup. So if I'm out sick or if I, went to Italy for some reason, I have no backups. Most of my patients, they all know that, but some of them are like, what? I'm like, oh, yeah, you want to get urgent care. But talk to them. What's the office like? What's the doctor like? Is that doctor going to align with me? Once in a while, I meet a patient and we just butt heads, and it's like, oh, I don't think it's going to work out. And I tell people, you don't go to Rooms to Go and buy the first sofa that's in the front of the door. You look around and see what works for you, And I have some people who drive across Lake Pontchartrain. They drive 30 miles to see me because we're a good fit, And then they get to be 80 and I say, I really think you need a doctor closer to you because your medical problems are going to get worse. And I don't want you driving across the 30 miles, every time you see a doctor. And so your needs can change over time too.
Right. No, I think that's, I think it's a good getting back to when you're transitioning into the adult world. I mean, it's not something I've really covered before with my lives and my educational videos, and I've done this since 2019. But I think, yeah, I'm going to add it to the list. This is super important.
Right. And men in general, I think young men, they don't think they need to go. They think they're indestructible, and they kind of are, and they don't need to go to the doctor. And the visits are usually very straightforward,
Yeah.
How about this? We do talk about sexual health. We talk about STDs. We talk about birth control. We talk about things that are pertinent to 25-year-old guys drinking.
Yeah.
So there are some things to talk about with your doctor.
It's funny too, because I see, hey, Miss Chris, my mother-in-law's in the studio. She's watching. So my husband saw regular doctor. When we moved to Baton Rouge, he saw a primary care physician, I think for 2 years, twice. And then fast forward 10 years, and I was like, this is ridiculous. Like, you have to see somebody. And he said, well, I don't know who to see anymore. So I think I put on South Louisiana PMG, like, hey, my husband needs a primary care physician, and this would be his preference, And one of the female physicians said, oh, hey, I'm in that area and I'm taking new patients and I'm happy to see him. And then Miss Chris, he didn't schedule the appointment for months. And finally I was like, that's it. Like, I'm going to have to schedule it for you, which is going to make you look like a child. Just schedule it. And so he finally scheduled it and then came home and was like, that wasn't bad at all.
Yeah. It can be fairly easy. The other thing the time people don't want to go to the doctor is because they're fearful. My mother used to say, every time I go to the doctor, they find something wrong. I'm like, Mom, you're 90. Yes, you got some problems. She had cataracts and high blood pressure and blood clot, But these guys in their 40s, they're working hard and they're like, what if they find something wrong? What if I can't work? What if I, am sick? And so there's a little fearfulness there. And that does happen. They come in and their blood pressure is sky high. I say, when's the last time you checked your blood pressure? Never. Right?
Right.
So you wouldn't know. I feel fine.
Fairly brings up a good or an excellent point as well. She said also thinking about when our kids transition to their own doctors, I think about the importance of educating them about family history, right? And so the things to focus on with your doctor when you transition.
Yeah.
I have a strong family history of colon cancer and a primary relative who had a polyp. And so I was like waiting and ready when I turned 40. Like, let's go. Screaming. Here we go, right?
I'm drinking this stuff.
Yeah, it was it's funny. I'll have to send you the picture after. But so then I had my second one this past year because I turned 45. So I've had two now.
Mm-hmm.
It's not bad. Yeah. But my then I guess he was still 9. No, he was 8 then. Drew me this picture and he stuck it on the bathroom wall right in front of me where I could see it. And it said, "Have fun cleaning out your bowels," with a picture of somebody on the toilet.
That's the worst part. The colonoscopy, no one remembers. The stuff you have to drink, everyone remembers.
Yes. Yeah, that's pretty bad. But if you aren't in a medical family or have someone and you're not seeing a provider once a year or every 2 years, then you don't know, when do you need certain screenings.
Right.
And
so a lot of times the screening changes. So, maybe it's 50 for a colonoscopy unless you had a family member who had it, and then it's 10 years prior to the age they were when they were diagnosed. So if your father had colon cancer when he was 40, you get one at 30. So very important to know.
It changes, right? Because I can't remember that, so I'm going to rely on you. So you can tell me when it's
let me tell you. And I have people calling their wives and calling their moms, and they're like, "Hey, what about Uncle Johnny? What kind of cancer did he have?" And somebody knows.
Yeah, absolutely. So I think when my mother-in-law said, like, "Thank you," I've wondered about that, like if her son actually goes to the doctor. So I made him. Made him get his flu shot. Took a really long time. He didn't get it until after Christmas, which I told him he couldn't be in the house for Christmas if he didn't get it before Christmas. But I was proud. When he went to get his flu shot, he also got his COVID shot. So on his own, yeah.
And I'm
yeah. But so Katharine, thank you so much for joining me. This has been
such a pleasure to talk to you.
So great and so helpful. And I think, I don't want to out you, but I think you said you were interested in doing the same, like education for.
Yeah. I am. I've been talking to my teenage kids because they're the experts. I'm doing maybe a YouTube channel about common problems and common things and what every person should know about their own health. So in the future, look for me, Dr. Katharine Rose.
Yeah, please keep us updated because I'll definitely share with everyone.
Thank you.
So we can subscribe and follow and like and all the things you're supposed to do on YouTube.
Right.
All right.
Well, it was such a pleasure.
Thanks so much. All right, everybody, have a great afternoon. Bye.